All right, this video will cover wrist and hand evaluation. We always start with observation. So the first thing you want to do is just look at your patient's arm, hand, look for anything that's obviously different between one and the other. You can have them do normal activities of daily living, buttoning something, using a brush, writing, anything that they would normally do so you can kind of see how it's working for them. Opening and closing the hand is something they should be able to do rhythmically, and then as well as opposition. You can also look at the color of the fingernails. They should be pinkish, so if they're more of a white color, they're not getting as much circulation as they should through that area. If you're going to palpate the hand, you really want to go over each carpal bone, metacarpals, phalanges, everything you can. Palpate that hook of the hamate that we talked about, and you can palpate any of the soft tissue structures. You really want to hit the tendons if they're having tendonitis type of pain or pain with actions. Try to isolate which tendon or tendons are causing that pain. As far as range of motion, you want to do the wrist as well as the fingers, and you should do it in this sequence. Starting with the wrist, you're going to do your 4 motions, which is flexion, extension, radial deviation, ulnar deviation. Then you can do metacarpal phalangeal flexion and extension, and then pip and dip flexion and extension. Then go back and do flexion and extension of specific joints in the fingers, the thumb, abduction, adduction, opposition, and then your opposition with your pinky. So you want to kind of get all of the main movements of each joint. Normal ranges of motion for the wrist, flexion should be about 80 degrees. And extension would be 70, so you should have a little bit more flexion than extension. Again, that's because you're getting the flexion at the radiocarpal joint versus the midcarpal joint, which is where your extension comes from. Radial deviation, like I said, because the radius is extending more distally, you're only going to get about 20 degrees. Whereas ulnar, you'll get a good 45 degrees. And if their ulna is shorter, they're going to have even more movement than that. All right, let's talk about the orthopedic tests. Finkelstein's test, very commonly used. Basically, you have them make a fist, tuck their thumb inside that fist, and then ulnar deviate the wrist. What you're looking for, this is one of those, if there's pain here, it's this. If there's pain there, it's that. So if they do that ulnar deviation and they've got sharp pain in their thumb, in the tendon over the outside of their thumb, we call that daycare vein syndrome. And if there's pain over the carpal tunnel itself, then it's carpal tunnel syndrome. Okay, and that's the median nerve. You're going to want to know that. The median nerve is the cause of that irritation and pain. So if they do this test and you feel like, I kind of think that that's a carpal tunnel syndrome, you're going to move on to the next 2 tests that we're going to go over in order to check and verify that. So this is one way you can do it. I don't personally do that much flexion because I don't think you need to get the daycare veins, which would be pain here. But if you're checking for a carpal tunnel, then yes, you would do that much flexion. So it depends really on what you're looking for. All right, the next one, here it is again, Tinel sign, happening at the wrist. You need your little reflex hammer. You're going to have them supinated and you're going to tap right over the middle of their wrist. If they've got any kind of tingling numbness that's going into the thumb, first finger, middle finger, and the lateral half of the ring finger, that is the area that is innervated by the median nerve. It's super weird, but yes, it's only half of the ring finger. So if they have that, that would be consistent with a carpal tunnel syndrome. So you're going to tap literally just right there over the end of the, just right at the end of the hand. The third test for carpal tunnel is called Phelan's test. This one is we're going to do is have them flip their hands over, put the backs of their hands together, and then force their wrist into flexion as much as they can and hold that for a minute. And if they have pain, then obviously they have carpal tunnel. Let me show you the picture. So they're going to go into this position, and as you can see with the carpal tunnel being right here, if I flex that and it's really tight and there's inflammation in there, this is not going to feel good after pretty much a short period of time. So this is a good test to rule in or out that someone has carpal tunnel. All right, your TFCC test, triangular fibrocartilage, on the ulnar side of the wrist, between the end of the ulna and the carpal bones, there's a little triangular piece of cartilage. It's called the triangular fibrocartilage. I know, really creative. But it can get torn, and you would think, oh, no big deal, it's a little piece of cartilage. This is one of those surgeries where it takes 6 to 8 weeks to recover. Not a small deal. This is a big deal injury. So what you want to do is passively ulnar deviate their wrist and then put an axial compression straight along the axis of the arm. That's going to just put compression right on that fibrocartilage. If it hurts, you need to send them for an MRI because they may have a tear of that fibrocartilage. All right, when we go to the fingers, you guys, when somebody sprains their finger, it's usually fairly obvious. There's swelling, there's bruising. But if you want to check, okay, I'm not sure, let's check it. You can take any joint in the fingers and you can isolate it. You can do a valgus varus test. You can do an anterior posterior glide, any of the joints. And if there's pain, if you palpate over that joint, then you've got a sprain in the finger. So again, you can get as specific as you want, but bottom line, is the finger sprained or not? It's usually pretty easy to tell by observation, palpating it, and then doing one of these tests. So this is just showing you, this is an anterior posterior glide, and then valgus varus, you're going to just take them and lean them one side and the other side and check those collateral ligaments in the fingers. All right, this is probably the hardest test, and it's the hardest name to remember. Lunotriquetral ballottement, okay? There's a joint between the lunate and the triquetrum, and what you're going to do is you're going to basically, if you take a hand and you have them flex it down, you will see at the end of the hand, the lunate kind of sticks up. There's sort of a roundish place just at the edge of the wrist. So what I usually do is I'll do that, find the lunate, grab it, flip their hand over while still holding onto it, and then you want to grab the triquetrum, which is just medial to the lunate, with your other hand, and then you're going to take those two hands and kind of go opposite directions. So I'm trying to see if I can move those two bones back and forth. If I can, then my lunate has probably been dislocated, because I should not be able to really get a lot of movement between those bones, because as I showed you in the ligaments, there's a ton of ligaments holding it together. So something significant would have had to happen in order for me to have that much movement. Okay, so this kind of shows you what I was talking about. You grab the lunate, you grab the triquetrum, and then you would, push down with this one and push up with this one, just trying to move them and see what kind of laxity is existing between those bones. Allen's test, this one's kind of fun. Try it on your, siblings or something, but you're going to have the person squeeze their hand really tight as much as they can, 3 or 4 times, really, really, really squeeze, and then hold it. And then you would push with both of your thumbs, one on the radial side, one on the ulnar side, to occlude the ulnar and radial arteries. Then you're going to have them open the hand. Their hand should be blanched, which means it's whitish, okay? And then what you want to do is release one of your thumbs. So let's say I release the radial artery, and their hand goes back to normal within maybe 3 or 4 seconds. Okay, that's good. Then do it again. Same thing, pinch both arteries. This time, release the ulnar artery. So as long as it comes back within a couple seconds, that's great. If you're not getting that normal pinkish red color coming back, then we have some kind of issue with the artery. You're going to need to get a diagnostic test for that. So you can do it like this with one hand. I like to use both my thumbs just because I think it's easier, but you can certainly do it this way if you like. All right, that'll be it for evaluation.